You guys are going to love it. So, hi, Heather. Glad you made it.
Good morning.
Good morning. Um, did you reach out to me on Instagram or were you the talking?
Yep, it was me. Yep,
Oh,
yep.
okay, good. So
Yeah.
you found it?
Yeah, it's different. It's like when I'm on my phone and looking for it, it's harder to find. But
Dang it.
when I'm on my desktop, I see everything. But when I'm on my phone, it's like it just shows me like 1, 2, and 6. So I don't know what
Darn
that's
it.
about. Yeah.
Okay, I wonder why. I don't ever use it on my phone either. So I'm glad that you kind of made me aware of this stuff. And what Heather's talking about is she did the first Feel Better program. And I did the first Feel Better program a little bit different. And there's videos all over and it's spread out in weeks and it's a mess. And I'm trying to figure out how to clean it up. I'm actually meeting with a web developer on Monday morning on Zoom to see if he can help me group it all together. But right now I'm limited. So I've learned from that first program, and I think I'm doing the second program a little bit better in the organization and stuff. Anyway, Heather couldn't find some of the videos on her phone, so I guess my point is please reach out, let me know. Even if I don't respond back immediately, doesn't mean you didn't give me that information and I didn't go to work, right? So if anything, if you can't find anything or anything happens with the website, just send me a message and just put it inside me and I will go to work and see what I can get done. Um, so I'll look into the phone thing. Let's see here. So Heather, I'm asking everyone if they've started to implement some movement therapy moments into their daily life. How's it going for you?
Oh yeah, absolutely. Because my big thing that I've talked about 1,000 times before is I have a strictly desk job. So there's a lot of just sitting at my desk, and I really like all the posture training because I know my posture has suffered over the past, God knows, my entire life probably.
Hmm.
So yeah, so a lot of the V work, I do a lot of that, and a lot of foot therapy too. So
Yes.
yeah.
Yes, I love it. Okay, this makes me very happy. And I'm so glad that you are gonna do the 90-day membership with me. And then are you gonna do some live classes with me when I get back in February?
Yeah.
Okay. What
Yep.
classes are we thinking? Have you looked at the
I've
schedule?
I've looked at this. I did one this week and I can't remember what day it was.
I know
And
I
I have
saw
to
you
think.
sneak in, but I don't feel like
Yeah.
I didn't know it was you exactly.
Yeah, it was me. Um
What class was that? I do remember this now.
Tuesday.
Yeah, Chief Low Flow Motion.
Yeah,
Okay.
yeah. So, yeah. So I don't know yet because everything's dependent on my schedule because I am in Denver. So, like sometimes, like the later classes I can't make it to because I'm at work, obviously. So the
Right.
earlier classes I'm looking at. So yeah, I
Yeah.
think it'll be yeah,
Even if like Saturday and one class on Saturday or one class on Sunday, like the mobility flow or the bar flow class would be great too, right? Even if
yeah,
so,
yeah,
I like to try to help everyone. Don't let Age Defy add a stressor, right? Like, oh my goodness, I have to do this, right? I really want to find a way for you guys are just like it's an easy fit, and then all of a sudden it just grows and expands because you want it to, right? You just start to feel good, and then you crave it more and more, and it just starts to fit in. But when you first start, you just really want to find one class. Like keep it so easy. Just kind of make the commitment of I'll go to one live class a week and I'll do one video. Like you know what I'm saying? Just start there. Um and then you find that one class, we'll call it Sunday Bar Flow. And we kind of commit to each other for that. Like I kind of expect you to be there every Sunday and you expect me to be there. And that's how we start to I think how you should do
yeah,
maybe a
yeah.
live schedule. Okay.
Yeah, well, and that's definitely what I appreciate about this is that when I started, the 45 day, I think it was back in October, it was nice because it was like every Saturday, I knew that what I was doing on Saturdays, it was scheduled for me. It's not like like super over cardio or super over strength training and like all that stuff can be done on its own, but this was something different that really was making me like move in different ways and like really figure out like what you've said before, like you move in weird ways and you figure out like, oh, why is that making that noise? Like, why
Yeah.
is that? I don't recognize that. So then you're able to sort of fix it later on. So, and yeah, and I think your classes spread out throughout the week and then on the weekends, great. And then the fact that there's online videos.
Yeah.
So,
Yeah.
if on a Monday night I come home from work and I want to do something, I don't have to wait until Tuesday morning. I can just log on and do 30 minutes with you.
I love it. This before class conversation has been just the best. I feel like I've my some of this is being really absorbed by all of you. You know, where whatever you needed to absorb, you have absorbed as individuals, right? Each one of you kind of have taken a new something of your own, and I love that so much. I am very appreciative that you've all have joined me. That's all that matters. That's all that matters. I'm glad that you're here. All right, so it's our last class today. Well, our final session of this program, right? And I wanted to introduce BarreFLOW. Why do I love BarreFLOW? One, I love BarreFLOW because it's the class that everyone does not like when they first start, but for some reason they just keep coming back, and then eventually they love it and they realize, whoa, this has really helped me and helped me with my posture, helped me with my poise. Foot therapy takes it to a whole new level. The gluteal strength and the range of motion in the hips. BarreFLOW became important to me during my hip pain years because, of course, when you have an arthritic joint, and I also had an acetabular cyst, I also had torn labrum. So you basically, on a daily basis, just lose mobility. Well, that's what you're supposed to. You're supposed to lose mobility. You're supposed to lose your ability to move, right? By the time I had my surgery, I had walked with an active limp for at least a year. Like literally, I limped. I walked into a room and I walked like this. But I did bar and I was still able to lift my leg, right? I think that bar kept the range of motion in my injured hip that was so injured that I couldn't even hide it from people. But yet when I did bar, you wouldn't notice it. You couldn't notice it, right? When I did some of the classes that I do, if I wasn't walking around, you couldn't notice it. But if I just walked, it was noticeable that I had a hip injury. I think bar helped. I don't think in one thing, only one thing helps, but I do think bar helped me to keep the gluteal strength that I was bound to lose because I wasn't going to use my glutes enough to be able to use my glutes enough to keep the strength, right? So I think bar helped me keep my gluteal strength that I was going to lose. It helped to stretch the long front line of my hip that I was definitely losing because look at this. When I was limping, I'm not going into full hip extension. Watch here really quick. This is what I call a body knowledge clinic. I do body knowledge clinics because the more your mind understands how the body works, when I tell you to do things in the classes, that body knowledge comes to play. Okay, so the hips, they extend, they flex. Okay, so unzip, zip. Unzip, the hips flex. Zip, the hips extend. Knee lifts, the hips flex. Knee pushes back, the hip extends. Walking, flexion, extension, flexion, extension. Okay? I had no extension in my walking pattern when my hips were so bad because I limped. So that meant it was always in flexion. You see that? Always inflection. I never got the extension part of my walk. Bar gave me the ability to continue that extension work. So when it was taken away from me in everyday life, I found a way to keep it in this movement practice. And even though I wasn't able to fix my hip or fix my limp, that had to take surgery. I could have kept limping even after surgery is all I'm saying. I think if I would not have worked all these lines using bar once a week, not every day, once a week, using these lines, I think that I could have kept my limp after my surgery, maybe even. I don't know. Or I don't think I would have been able to have my range back. So that's why I'm so passionate about barre, and that is why we are doing it today. So with that said, I want to teach you how to do a setup for barre. A setup for barre, you would put your yoga mat like this, and then you want to have like, so this is just like a patio chair, like a outdoor patio chair is what I have. And you know, if you look through some of my videos, you'll see that I had different chairs. You'll start with a chair today and you'll figure out your way as you go along. But you want to keep, I like right now the setup where the chair is in the middle and I've got the back legs on the mat because I like my feet on the mat sometimes. I also like them off the mat, right? So I like to create a little space for me, but also the chair doesn't slide. Okay. Now, if you have carpet in your house, you might not even need a yoga mat. You could just do it on your carpet. Just depends. It's up to you. I also like to have space to move here. I like to use space here. Sometimes we sit on the chair. So basically, I'm just creating a flow of whatever I want to do. We have room to do it. Okay. When I'm teaching barre classes, you always will keep your barre in one spot. Like you will never move your chair. If you've taken a barre video or if you've done a barre class, I am moving my chair all over the place. I don't actually, I've trained my body so well and I've done barre so much, I can literally do barre without the barre. But I love the barre. So I still use it, but I also need to show you what is happening behind your barre. Okay. So when I'm moving my chair, resist the urge to move yours. Okay. And then with that said, when I move my chair, I'm just opening up basically the view for you. Okay. The other thing that I think helped why I love barre and what helped my hips and helped me continue to be strong during my pain years and even stronger after my hips were fixed. And then even coming back to Heather, you say you're doing a lot of the foot therapy. Barre foot therapy is different because in barre, so these are my feet. I like to show my hands, so I'll show my feet a lot. In barre, we do what's called turnout positions. Okay. Now, some of you, like me, before my hips, might have a natural just turnout. I call it a duck walk. I can't even tell you how many people in my life, course of a life, has asked me if I was a ballet dancer already just because I had such a tremendous duck walk. A turnout walk is bad. But it's not bad. It's just this is not what we want unless we do it on purpose. This duck walking, external rotation walking of the hips is done because we're not connected to all the work through the body. We really want our feet to be here, right? But on purpose, we want our feet to be able to handle this and handle this so that we can meet in the middle. So barre, even though it's a turnout practice, it actually helped me learn where I want my feet when I walk on an everyday basis. Okay. So also when you turn out, you're working the ankles and up the line in a different way. Okay. So barre has a turnout. So go ahead. Let's begin with a little bit of movement and body knowledge. Walk behind your barre and put your hands on top of the barre. Now I said, bring a pair of socks. I have a pair of socks over there too. It's not that important, but the socks do help you kind of, especially when you're starting, slide back into when we do a lunge. Okay. So socks or no socks, it's up to you. It's not that big of a deal, but really quick, go ahead and get behind your chair, your barre like this. I'm going to come up to the front so that I can show you on my hands what's happening for now. Align your feet. Oh, let me let Carrie in really quick. Well, let me make sure it's 9. Okay, it is.